Hello, everyone. Welcome. Good morning. We are very happy to be here with you guys. And my name is Alisa Ghazvini. My colleagues and I are here from the National Center on Subsidy Innovation and Accountability, called NCSIA, or the Subsidy Center for short. It is one of the technical assistance centers in the Federal Office of Child Care's Technical Assistance Network. And our job is under OCC direction to provide technical assistance to states, territories, and tribes. So we're here today to share with you our role helping states, territories, and tribes navigate the subsidy requirements within the Child Care Development Block Grant. Before taking on the role with NCSIA, I served 10 years as the executive director of the Association of Early Learning Coalitions in Florida. So Florida is one of those states that has a strong state local framework for how they deliver childcare. And so I was staffed to the 31 coalitions across the state of Florida. And then I've served as a national consultant for over 25 years prior to that, or including that time period. So we're very glad, and I'm going to let my colleagues introduce themselves.
Go ahead, Marybeth.
Good morning. Hi, I'm Marybeth Jackson, and I'm with the Subsidy Center as well. I've been with the center for about 7 years, and my title is a TA liaison. So what I typically do is work at a regional level with the states in that region to help support them as they develop policies and innovations and try to meet the requirements of the CCDF block grant. Currently, I'm in the Region 1 area. For those of you who aren't familiar, it's the Northeast New England states. I've also served in the Southeast in Region 4 and in the far Northwest in Region 10. So had an opportunity to work with a number of states in my almost 6-year tenure here. So very glad to be here. Prior to this position, I was the CCDF state administrator in Kentucky for 7 years. And I told someone earlier before it started, this is an ever-changing system, and I learn something new every day to this day about CCDF. It's ever-changing, and there's lots of intricacies for it, but hopefully we're going to target and hone in on just the subsidy side today. So thank you. Glad to be here.
Good morning, everybody. I'm Gladys Wilson, and as I stated the other day, I've been walking with dinosaurs in this area. I've been doing it a long time. I am the TA manager, so I work with the 10 technical assistance liaisons that work in all 10 regions. And so we work together to try to work smart and help the states and territories and some tribes really figure this out and be effective and accountable for that. I will say that when we go through all this, we definitely work under the direction of the Office of Child Care. And so we help try to make this work doable at the state level or the territory level, because all of them are different. Like Alisa mentioned, Florida is a locally controlled state, much like Texas and Colorado. There's about 4 states, and New York is the other one, that are very much locally controlled. And for those of you who are sitting here saying, well, my state really is, well, you need to look into Florida, Texas, and Colorado. You really want to know the meaning of that. So I was the state administrator for the state of Florida for 7 years. I also was the CEO for Qualistar in Colorado for about 7 years. And now I've been doing this technical assistance work for about 7 years, which just tells you. And before that, I was in the school system, so and Head Start. So do you need something, Louise?
We have a technical issue. I just wondered if that was a technical person who stuck her head in.
Okay.
The people on Zoom are seeing this in presentation mode, not slideshow mode.
Okay,
Can you put it in slideshow mode?
sure.
And if not, I'll call the tech guy.
Okay. So we, like Mary Beth and Alisa said, we're going to try to demystify some of this, but it is very complicated. So we're just going to give it the old college try. And
How's that?
That's what we want. Thanks.
Okay.
the other thing that I just wanted to clarify, because sometimes, no
All
problem.
right, never mind.
We can, you want me to try to go get him?
You could, if it's not going to disrupt your presentation.
It shouldn't, no.
Okay. No.
There, for those of you who may be less familiar with CCDF or CCDBG, they're the same thing. Okay, they're just called different. Some people call it the Child Care Development Fund. Some people call it the Child Care. I can't even think of the name. So, but they're the same thing. So whether you hear which acronym you hear, they're one and the same. States are given an opportunity to submit a plan. It is a block grant, which means they have a lot of flexibility, but you have to understand the regs, know the flexibility. So anyway, what we want to know from you all, and I think if we do this really quickly, you can just tell us who you are, because this presentation, these slides, we would be happy to put them aside and have a conversation, but in order for us to know where we need to go, it would be really helpful for us to know who you are. So I don't want to spend a lot of time. All we want to know is, you don't need to tell us your name because we won't remember. But what you can do is just tell us, are you a provider? Are you from a network, shared services network? Are you from an R&R? And are you from a family child care network? And if you're more than one, which I know there's one or two in here that are, then just give us a sense of who we're talking to, because we may change our back and forth a little bit.
And we're going to
Okay,
actually
Louise.
ask you to do this into the mic so you just pass the mic as you introduce yourself. Otherwise people can't.
And let's do it quickly.
CCDF State Administrator.
Okay.
Texas Workforce Commission. CCDF State Administrative Office.
For Nevada.
Ohio Department of Job and Family Services.
Tech provider around training, business training.
Also a tech provider around managing subsidy.
Okay.
Vendor with Wonder School.
Coalition overseeing shared service network.
Shared Service Hub.
Shared Services Network in Wisconsin.
Shared Services and EHS CCP.
Policy Advocacy and Coalition around Shared Services in New Mexico.
North Carolina R&R network, statewide R&R network and subsidy provider.
Okay.
Early Learning Hub. Shared services.
Shared services, CCR&R, Head Start, ECC, Colorado.
Same.
Technology provider for subsidy systems.
Technology and business support.
State of Iowa CCDF Administrator.
Texas Child Care Provider.
Louisiana State Department of Education Manager of Shared Services.
Shared Services, Michigan.
Same.
Provider Colorado.
Colorado provider and staff family child care network.
Community Development Financial Institution.
Shared Services in Michigan.
Shared Services Alliance in South Carolina.
Vendor with Control Tech.
Okay. Very helpful. Thank you.
The state representation is great. I look to you all colleagues to weigh in on these topics and see what you're grappling with at the state level. When I was at the state level, it was proposed to me from an R&R, had no clue what it was. So I've welcomed what you all have received and your experiences so we can, in our work, help states that we work with as they're going down this road in this journey. Thank you.
Okay, so you want to go to the next slide?
I'm trying. Okay, now it's not.
When all else fails.
Okay.
Oh, do you need to change it? Oh,
Well,
no, can't.
Yeah. Here we go.
Okay, all right, now, here's the agenda, but really our agenda is to have a conversation. So we, like I said, we have prepared these slides because we've been in places where
You
it's
need
like
to talk
crickets.
into him.
So
Mike.
we have them here, but we want to encourage you at any point in time, if you have a question, just raise your hand so we can have this conversation. If we don't get through every slide, we're fine with that. We're here to help you. And as I said earlier, I promise you, we will learn from you. So this is what we have set as an agenda, and we're going to give you kind of the very high level view of the Child Care Development Fund requirements and flexibilities. We're going to talk about the benefits of subsidy and shared services, partnerships, and then kind of break it down between, all those groups, which is why we wanted to know who was in the room. If we hadn't had any state administrators, we wouldn't go there, And then we're going to talk about some of the recent efforts to build supply during the pandemic and how that's changed a little bit of what CCDF looks like in different states, and then the questions and answers. But I really do want to encourage you, stop us, ask questions, ask for further clarification, and we'll try to keep this moving and engaging for you all. Did it go?
Yeah. Okay. All right. So this slide is kind of like CCDF 101. And this could be a week-long session. So what we've done is really try to highlight some of the very, very highlights that may be applicable to your work as shared services hubs, also as providers, and also as state agencies. And then I'm leaving room at the end of this slide for questions. That's your opportunity to say, my state always says this, and I don't think it's right. So, we can maybe try to navigate some of those things for you. So the purpose of CCDF or CCDBG, it's interchangeable here. We've heard it said both ways when we've been here. It's designed to allow states the maximum flexibility in promoting parental choice of high quality childcare options that support their child's growth and development in their family work and educational needs. One key takeaway here is it's a block grant. Unlike maybe your SNAP programs, which are entitlement, it's blocked. So you think about your state that you're in gets an allocation from the federal government based on a formula. Some states have additional money to put into their funds. A lot of states don't. So just know when you're navigating and working with your state agencies, they have a set amount of funds. So when they allocate more money for something, it lessens in another area. So it's kind of like that seesaw effect, but it is a blocked grant. In terms of eligibility, so your question may be, who's eligible for subsidy? Well, that's where this slide kind of talks about flexibility. The federal requirements are the child should be under 13 years old. They can be up to 19 if they have special needs or under the direct court supervision. The income cannot exceed 85% of the SMI. Some states,
SMI.
state median income. And what I'll say about that is a number of states set their eligibility threshold at that. Some states set it lower. When they do that, they also have to have a provision called graduated phase out, which allows a family to just not get suddenly cut off when their income goes up. So it slowly allows the family to slowly navigate off the program where they're just not hit with everything just by making a few dollars extra. The other thing, the parents have to be working or attending a job training. So you'll hear a lot of times in states, a lot of TANF families. Now, TANF is named differently in every state. It's not always called TANF, but that would be something if you're interested in your state to find out the name of that program. But a lot of families served under the CCDBG are also served under TANF.
And what does TANF stand for?
Wow, Gladys, she is full of the quiz. Temporary assistance to needy families.
Yes.
There is flexibility, and you'll hear things called direct TANF transfers. And when the certain TANF dollars go across, they lose the TANF identity and become CCDF funds. Now, back in my day, a while back, over a decade ago, when I first took the job as a state administrator, we received the entire TANF transfer into our CCDF program, and that was great. Well, as funds started drying up and money started getting hard, we lost it all. So there are, and that's something we could probably find out how many TANF transfers are still being used for CCDF now, but that number has declined quite a bit over the years. Let's see, where was I? Oh, the other piece, the training or educational program, the CCDF program, depending on that, this is a flexibility at the state level. It can pay while parents are attending education as well. So there are some states that families can qualify for subsidy if they're going to college or if they're trying to finish up their GED or anything like that. So that's another flexibility that states have. As I say that, it doesn't mean all of them do. So this is where you kind of got to know, and we're going to show you how to find your state plan. You kind of got to know the intricacies at the state level, because they may have statutes and regulations that their hands are tied. But from a federal perspective, there is flexibility there. Another flexibility is they can provide subsidy to children in protective services or prevention. So those are children with, they would put them under their special needs definition. So that looks different in different states as well. See, this is what we were telling you. This is very intricate, but some states have a different funding stream and they pay for those kids and the childcare arrangements for those children in a very different way. But a lot of states use their CCDF funding for children who may be in foster care or who are under the care of the child welfare system.
And I would just add that the states define who is a protective service. So it could vary from one state to another who's eligible based on that status. So the state defines that. So this is why it's real important for you to understand what's going on, where you're trying to make this work. So
some examples of that may be grandparents raising grandchildren. The state can name that as a protective service. Drug exposed infants, that's another one. I mean, we've seen lots of innovations and there's a state flexibility. So depending on what you know about where your coverage and what area you're in, that's a flexibility that the state can have.
Homelessness is another area.
Yes, thank you. That's a big one. Okay, so in terms of eligibility, is there any quick questions or any clarifications or anyone have any, hey, is this group categorized as eligible? Okay, all right. So now we're going to move to enrollment. So once the family or the child is deemed eligible, this happened in 2016 as a result of reauthorization, and this is helpful to all of us, but they now have a 12-month eligibility. When I went into Kentucky in 2009, we were doing reauthorizations at 3 and 6 months. And think about the burden on those families, because there wasn't a lot of automation. They were going back into local offices to redetermine or verify information. So this has been a good move. It's been in the positive direction. The last state plan, which was not this current one, but the one before this one, was the first state plan post reauthorization. There were a number of states that had not gotten to 12-month eligibility yet. It was kind of a big push. A lot of states didn't have 12-month eligibility. So they had to do a lot of changing of their regulations, their policies, working with their TANF programs. But I'm happy to report that that number is very low now. So as a whole, I'm saying maybe 1 or 2 states are the only ones that haven't reached that. And it's usually a a state law that's keeping them from doing it. Maybe there's some law in the TANF program that they have to get information in 6 months to reauthorize. So it's not for the lack of will, it's just they're fighting the legal process to get these changed. Let's see. Oh, here's a biggie. So lead agencies can contract directly with providers for services. I'm going to leave it there because Alisa is going to talk about that more. So when you think about eligibility, originally it was the form of a voucher. So the family, you know, is they do everything they're supposed to do. They provide their income, their stubs, their education, whatever verifications they need. And they're basically given a voucher saying, you go out into the world of childcare as we determine and find the center that's most appropriate or the arrangement that's most appropriate for your needs. But in the recent, probably, well, in the last decade, there have been some states that have gone down this road of contracting directly with the provider. So that's in the form of slots, and we're going to go into that more. I'm not going to belabor that one because we'll talk about more. Another flexibility is attendance. CCDF was historically criticized because there were actually states paying for actually portions of days. So let's say parents were going to education and training on Monday, Wednesday, Friday. Their classes were Monday, Wednesday, Friday, and they were in class from 8 to noon. Literally, their voucher would say Monday, Wednesday, Friday, 8 to noon. And the state would pay that provider for Monday, Wednesday, Friday, 8 to noon. Not the typical way providers charge private pay families. 12-month eligibility has changed that a lot. And also just the flexibilities that states have been afforded. States were real resistant because that meant more money was coming out of that blocked grant. Remember, it's an isolated amount of money that they don't have any extra unless the state puts in. So they were real hesitant because what it meant is the program was going to cost more. But what we all know is that's how private pay families pay. They don't get to pay, oh, I only need the care 2 days a week. I only want that rate, because providers have to plan for staffing and making sure those ratios are in effect for the entire day. So that's a flexibility. Some states have more liberal policies than others. We are seeing a move toward more liberal policies around attendance. There's still some. But the grants and contracts piece that Alisa is going to talk about, she can go into the attendance.
And I was just going to add that flexibility for attendance is not only a benefit for the provider, but for the families. All of you that have been to school know that if your classes are Monday, Wednesday, and Friday, or Tuesday and Thursday, you're still you've got a lot of schoolwork in between there.
Mm-hmm.
So it's good for families and providers.
It is.
Yeah.
I think everyone in this room can agree that those attendance policies being a little bit more loose are better. Now, I will say it doesn't preclude providers from needing to take attendance. Right. So we had this conversation earlier. Taking attendance and acting on attendance are two different things. So a lot of providers need to take attendance for the CACFP program. Attendance is not the issue. It's when the subsidy is altered in some way, or the benefits and the payments going to the providers are altered as a result of the attendance. So I just wanted to make that clarification, because if you find out your state requires attendance records, don't be upset until you find out if they act on those, because attendance and acting on it are different. So some other service options, we wanted to point out in the state plan that there are these equal access provisions, and that ensures families have options and a full range of childcare services, which really gives them center-based family childcare. You all have heard about the deserts. The state's on the hook. They've got to increase the supply and do supply building when they recognize these places where there isn't equal access to childcare across the state. And lead agencies may impose more stringent standards and regulatory requirements on providers, but they can pay based on enrollment rather than attendance, and they may pay above the private pay rate. So we can talk about that in the discussion. I'm opening up for questions now. Does anyone have any questions on anything we just talked about? Correct. Oh, Louise.
I just want you to clarify something for the
Okay.
audience, which is when you say flexibility, it also means the federal government doesn't say, these are the documentation paperwork you need. These are the forms you have to fill out. States can make this much simpler or they can make it much more complicated. Because so you could talk a little bit more about that.
Sure. Okay, so you may have heard me talk about verifications for the requirements. So for example, I can, one of the states I've been working with, this is around, let me get a good example. Special needs. Let's just do the special needs definition. When I looked at what they require for a family to present to them in order for maybe a child who's over 13 to be eligible for CCDF, it was like, we need the doctor's note and we need the CT scans. I mean, I'm just being, that's not real, but it was a lot of requirements. Okay. Like, and I was like, could you maybe just, a lot of times states will say the parent just needs to attest to it. The parent needs to say, I had my child at the doctor and he or she was diagnosed with this. So that's what I think Louise is getting at. So states are afforded the opportunity to be less prescriptive in what they require from the families in order to deem a child eligible. That probably wasn't a good.
Well,
good-
and what I would add to that is in their state CCDF plan, which you can access, you can see how the state has described how they are going to ensure the integrity and accountability of the funds. So that's where in the plan it tells, okay, this is how we're going to track attendance. This is how we're going to ensure a child is actually in a seat, those kind of things. So there are places in the plan. The state has flexibility, but they still have to describe how they're going to ensure accountability of the funds.
Thank you for bringing that up. Yes. So states have to go through an error rate process where they sample a number of their cases that were deemed eligible and determine if the worker or the system deemed the eligibility appropriately. So again, the requirements can be looser if it's overly burdensome. But the state has to outline either in the regulation or policy what verifications. So I mentioned a doctor's note for the one state I worked with. If in their regulation or policy, it says a doctor's note is required, they need to get a doctor's note. So that would be a regulation change. But from a federal CCDF perspective, the state has the flexibility of changing the regulation to something that's less burdensome on the families.
With that error rate process, is there anything like that for billing that required?
For that error rate process you just described, is there anything like that on the billing side where the state's required to confirm the amount of money was correct?
Yes. So the error rate process, they deem a case, the case was deemed appropriately, or I don't know the word. It was maybe there was an error in the case in identifying the eligibility. So then at that point, they determine the payments that have gone out. So you have something called overpayments and underpayments. So if there are overpayments, the state has the flexibility whether to collect those or not. So some states may set up a plan and start getting, recoupment of those overpayments. And then some, depending, they only set thresholds, they will only go after them if it's, over $500 or so forth. So yes, payments are attached. Did that answer your question?
Yeah, I just want to clarify, is that only if the family was incorrectly deemed eligible?
They only catch it through the case review process, but then there's also the fraud component. So if they identify and detect fraud either through the error rate process or outside, they do need to recoup those funds through fraud. So that's when those would go to investigations and so forth.
Thank you.
And I would just add to, remember the states have they have an auditing requirement within the state. So even if it doesn't get picked up in with the error rate, it could be during the audit, something like that could be picked up. And also lead agencies are monitored. Whatever,
By
I'm
the
not,
monitoring, yeah.
yeah. So they're also monitored by a team from the Office of Child Care. So there are other ways to pick it up if it isn't picked up in the error rate. Any other questions? Yes. Back.
So since you were talking about overpayments, does a state have flexibility to say, we'll assess an overpayment for noncompliance based on the date we found the noncompliance until you come into compliance? So like for providers, for instance, or do we have to go back to like when that noncompliance existed, which may have been 6 months prior? So I bring this up just because so for instance, say a childcare provider didn't have maybe the insurance requirement for a period of time. And we find that out March 1st of this year, but they were non-compliant since November. Do we have that flexibility to define that overpayment?
So when you talk about the insurance requirement, are you just speaking to something that's a licensure requirement?
Yes.
Okay. So that's a good question. And subsidy systems interact with licensing systems in different ways. So for example, if there's a licensure issue, states have different policies. Some states, the licensing agency will report it directly to the subsidy side of the house. If the subsidy chooses to do that, it would be in the regulation and policy. And if it is, they have to act on it.
Gotcha.
But there's a lot of situations where those two systems are, for lack of a better word, siloed. So usually those licensure reports don't actually get reported to the subsidy unless there's a closure. Because if licensing takes action against a center to close them, there's no care for that subsidy family. So then the state's got to go in and figure out where those families are going to go and notify them appropriately. Any of my state people have any other comments, policies they want to share around this issue?
And
so
I'm from a
again,
state,
this,
so it's just it's
Okay.
interesting because it impacts parents and it
It
impacts
does.
the feasibility of providers. So we actually just looked at what CCDF like guidelines say, and it does. I think it says something like the purpose is not to penalize, like not to make the situation worse, basically. So I think to Louise's point, we've had so many requirements that now we're taking a fresh look at to say, you know, how do we continue the viability of the network and not just penalize ultimately parents, or in this case, a provider that is the only one serving the Colorado River Indian tribe. And if they close, it's detrimental. So it's just helpful to understand
that insurance requirement did not result in closing the center down, correct?
We're hoping they stay open. We're still working on it.
But you all didn't take an action to shut them down for health and safety reasons, right? Okay. All right. So, okay. I see. Okay. Yeah. So that would be something we can talk after this, but it would be, we can tell you where in the state plan to maybe get at that information. And okay.
So, and I would just also add that the state can address that in their policies and procedures. Okay. So if they haven't done that, then it just, you know, having been a state administrator, if a group came to me and said, look, this is what's happened, then there's a way to address it in the policies and procedures. But you can't go off and do stuff if it isn't in your policies and procedures, because then you can see how that would open a can of worms. But there are so many, I mean, and some of you are going to walk out of here and go, oh my God, I wouldn't touch subsidy with a 10-foot pole. And I have to tell you, it is incredibly complicated, but there are some basic tenets. And one of the tenets that I would remind people of, it kind of goes back to the statement that Marybeth made, is that the state can be more prescriptive than the federal law. Okay. So the CCDF may say X, and then your state says, not in this state, and it can be more prescriptive. So you just need to understand that lead agencies sometimes have their hands tied by state policies and laws. So there are ways to change it, but if anybody's ever tried to change a law in this room, you know that doesn't happen overnight. Yeah. And she lived to tell the story. So, you know, there obviously is a way to do it. It doesn't happen quickly, but it can be, but if you have issues, then you need to start with the policies and procedures, and also make sure there's no state law that says if this happens, this is the consequence.
And I think this also underscores the importance of developing relationships with
Absolutely.
your CCDF state agency, and just having these conversations and finding out where their flexibility is and where there's a hard stop and how you might be helpful.
Absolutely. Absolutely. All right. It's to me.
Yep.
Okay. So.
Oh, yeah.
There we go.
All right, now, there's a disclaimer on this slide, just so you know. It says 33 lead agencies support or plans to support shared services or family child care networks. It is very important for you to understand that not every state defines shared services the way you do, okay? So this number you may sit here and go, well, I know my state's not doing it, but so when they report it, they may define it differently. We did this slide so that we could show you that there is movement in this area, but we can tell you, and I'm happy to share this, where in the plan a state says they do this and how it's, how it's defined. So if you're in a state and you're like, I want to know if my state is in there, we cannot give you the list of 33 states. It wouldn't be helpful to you anyway, because probably 19 of them, and that's just a random number in my head, define it in a way that you would not define it as shared services. But there is a way for you to find it out.
And how a defined, oh, sorry. It's for
Okay. Also, how the states define a staffed family childcare network is different based on each state
Correct.
too.
Correct.
Yeah.
So
You are absolutely right. And thank you for bringing that up. But you can find out how they define it. So, and there's no reason why you can't start having conversations now. They just submitted their plan. So it's going to be 3 years, right? Before they submit a new one. It may take you 3 years to build that relationship, but it's never too early to start saying, can you put this on your list to talk about when you start doing your plan? Just side note here, the state is required to have a public hearing on their plan. So you can go to these public hearings, and I know a lot of them are being done electronically, virtually, whatever, but you are able to provide input. So just kind of put it on your calendar that, this is an area where you want to start talking about making changes.
And just one more note to add to what Gladys said, you don't have to wait till the next plan submission, because states have the liberty to amend their plans.
Correct.
So, we've heard it during this conference, all of the money that states have and that they're going out the door, they can actually develop relationships with shared services hubs, staff family childcare network, and actually get those in place before they have to resubmit their plan. They can make the changes.
Yeah, there's a process for them to amend their plan that they just now submitted. So
Gladys, clarifying question. When you say 33 lead agencies report shared services, I'm assuming this is in the quality portion of the plan. In other words, they're saying that they're spending a portion of their quality dollars to support shared services or family childcare network.
it's actually in about 3 different places in the plan.
Yeah.
One section is the equal access provisions
yes.
Of section 4, where they're talking about how they're ensuring that they're going to, make sure that the full range of providers
By
are available.
supporting the providers.
Mhm.
So that it kind of goes back to the question earlier about we might have to close this person down so that the shared services might be the solution to supporting those providers so that they don't get themselves in that situation. So I'm happy that we actually wrote down where it is in the plan. So if anybody's interested, we're happy to share that with you. If you're not familiar with the plan, it's, you know, giving you these numbers right now wouldn't be helpful. Louise, we have another question here.
And while I'm carrying the mic over to this question, yes, yes, we want to know where that is. So you should, you can send it to me. I'll share it with people.
Okay, that's what I'll do.
Louise's question actually sparked one for me, which is about how the money is divided. So I'm not that familiar with the plan, but I understand there's a plan that's about quality, right? And so do states take the pot of money that they're allocated and say, we're going to do in the plan? Do they say, we're going to use this much for quality, this much for slots, this much for whatever?
That's a wonderful
So
question.
glad you asked that.
I was supposed to address that in my slide on CCDF basics. So states are required to spend 70% of their allocation from the federal government on direct services. When I say direct services, you can take it how you mean it, but that's subsidy. So the other 30% is in the quality.
But remember, they've also got administrative costs, which is 5%. Right, 5% admin.
Yeah.
So that dollar amount's dwindling. And until just recently, there has never been enough money to serve the families that are eligible. Never. In Florida, the years I was there, we always had 50,000 kids on a wait list, always. And I'll bet you, and the minute if we went out and filled and placed all 50, we'd get another whole slew of families because families quit applying because they can't get in. And so there's more need than there are dollars. And I just want to say this as a former state administrator, and I think those of you that are sitting in this room, until recently, there has never been enough money. They fight politics on every single level. It is a really tough job. And if you think, I wish they would do this, that, and the other, then I would really encourage you to go and start having those relationships, because honestly, they are so bombarded with so much that sometimes things get overlooked. And as a state administrator, I was always grateful. I didn't always want to hear it, but I was always grateful for somebody to say, you know, this just isn't working. And can you help us figure this out? But you can't do it at the last minute. It takes time. But I just want to tell you that it's a hard job. And right now, the turnover rate in state administrators is more than 50%. So you've got to understand too, that sometimes you may be dealing with somebody who's learning that you know more than they do, to be quite honest. So cut them some slack.
And trust me when I say, because I work with states, you know, the mass exodus and the workforce issue for childcare as a result of the pandemic, state governments are facing the same exact thing. Their institutional knowledge left and did not come back. So we have brand new people that have never worked in CCDF around these ARP dollars and the pandemic money. What states are telling us is, we don't have anybody to tell us how to get the money out the door. And that's a real problem. So when you hear the states not getting the money out the door, it's not for the lack or the desire to do it. It's the bureaucracy to get it out the door in the way they're supposed to. So just, yeah, we definitely wanted to convey that point. Be easy on your state administrators and your staff.
You know, and I used to say this, that my biggest thorn in my side was my purchasing office. And I would say to them, it is your job to help me figure out how to legally do what I need to do. It is not your money, and it is not your job to tell me why I can't do it. It is your job to tell me how I can do it. But that is not an easy conversation to have with purchasing, because often they do think it's their money, and budget office is the same. So I would just say to you that it is not always as easy as it looks, honestly. And it takes forever to get anything.
And I just wanted to add that 70% in some states, they set the it higher.
Right.
They say, no, we want 78% of these funds to go to the seat for the child.
There's a minimum quality
Yeah.
amount that you have to do.
Right.
It used to be 12%. That may have changed, or it was gradually increasing. But yes, some states increase that and they do the minimum on the quality. I wanted to say on the other side of the state purchasing, why if you don't have, those relationships with your state office and you are an agency that can do some of those services, get a relationship with your state office because they do have the flexibility to do contracts through. We partner with our, local agencies in the state with our CCR&Rs. We do a lot of contracts through them because we do have more flexibility to act rapidly. In Nevada, we were able to get up our Nevada Strong Start Center, which is our defined family child care network hub where we are trying to unsilo the silos and bring, we have Candelin that we brought over from Arizona. We have Wonder School. We have home community health providers, community health workers. We have brought everyone together in a actual building where providers can go and get one-stop shop for everything they need for childcare in Nevada. And we were able to get that up from concept to execution within 18 months because of our work through our CCR&Rs.
Thank you. You just covered a bunch of my contract discussion.
So it's critical because we would still be waiting in the queue to go through state purchasing had we tried to do that ourselves. So
Good. Thank you so much for that.
And I'm watching the clock because I want us to, there are some important things like grants and contracts, which I think is huge. But the next slide is talking about what's in it for lead agencies. And I just want you to take a look at this real quick. And then if there are any lead agencies who want to add to this list, then let's, please do that. This was our best effort to just kind of outline some of the things that we think. It kind of goes back to my statement about the many burdens that the lead agency has. Think of yourself as someone to help solve their problems. And if you go to them in that spirit, you're going to get a lot further. And so these were just some of the things that we have seen and experienced in our work with states. But if anybody else has anything to add, feel free to, I think the biggest thing, access is really important to families. And we believe that that's one of the biggest benefits is being able to improve that access for families through these networks because the provider system is stronger. And so you don't have people having to shut down except for the pandemic, whatever. I mean, will we ever be able to not talk about that? And just the impact it's had on this industry has been tremendous, but it just makes the case for this is the time to get strong and to stay strong. So I'm not going to belabor this point, but if anybody wants to add to it, then please do. Otherwise, we're going to go to contracts and grants because I think that's really will be a helpful conversation. Okay.
All right. So as we said before, lead agencies may contract directly with providers for slots. Not a lot of states do this for the very reasons that Crystal talked about, is that they often don't have the system set up to do that. And that's where they could use contracts with other entities, partners that they can use. But that is an option they have, so that we wanted to make you aware of. But as Marybeth said earlier, states are required to give families the option for a certificate or a voucher. That's a requirement in the rule and reg for the block grant. That is part of the foundation of parent choice that was written into the regulations. So parents have to be given that choice for a certificate, but that doesn't mean they can't do contracts with a certain number of providers or through a partner agency. And how they set up those contracts, they do have a lot of flexibility in how they do that. And we're going to talk about some of the different ways they can do that. But as you know, and we've heard talk at this conference, that ability to contract slots with providers is so important to providers. It is more in line with market payment practices. It gives them some stability. That 12-month eligibility for the child, and now you're saying 12 months you've got down the road. And then the state can still have in place some checks and balances to make sure the child is still being served during that time. But there is a lot of flexibility. But grants and contracts, which, by the way, the term grants and contracts is used interchangeably in the CCDF regs. So depending on the state, they may say contracts or they may say grants, so that you're aware of. But contracts really with partnering agencies basically fall into two buckets. One bucket is we'll do a contract. It's typically time limited, and it's for a very specific purpose. Let's say you're going to provide coaching. You're going to provide business practice training. And so they can enter into a contract depending on their state procurement processes with an agency to do that. Another type of contract is called a subrecipient contract. That type of contract comes with a lot more requirements, checks and balances, accountability, process, but it puts the partner agency in, they are actually helping deliver program requirements of the Child Care Development Fund. So subrecipient contracts, they might include, you're going to be in charge of eligibility determination and enrollment. You're doing some type of program requirement that they pass that requirement along to you. And so you're going to be monitored and managed according to the federal standards for delivering those services. Oh, thank you. So here's talk a little bit about the flexibilities and some of the requirements here. So there's a lot of budget options, and this is why it's so important for state and territories to develop really strong relationships with their budget staff. Sometimes those people are within their office and sometimes they're outside of their office. Sometimes there's both that they have to work with. So understanding and developing those relationships are really important to help them think about, okay, how much are we going to provide through certificates and vouchers? How much of service are we going to provide through contracts? How are we going to make sure we meet the percentages that are required in the law? That's really important. And then you have all these procurement, which we've touched on a little bit, how important it is to work with your procurement staff. Some states have really complex processes to go out for bid. Others have ways to maybe develop contracts through interagency relationships with other state agencies, with universities. So it depends a lot on the state as to how procurement is set up. And as we said, as Crystal said from Nevada, sometimes it's so much easier for a state to do a contract with a partner to get services out the door, because the partner has more flexibility. They may already have a system where they're communicating directly with providers, like many of you in shared service networks. And so it is easier for them to get services, money out the door directly to providers. So that is a plus on your side in many areas. Deliverables, again, can vary a lot. And that's an area for you to negotiate with your state. Sometimes a contract can embed linkages to the quality rating improvement system in your state. So you're also making sure that you're supporting providers with that, or at least linking with that. It could include some provision of comprehensive services, child screening and assessment. All those things can be embedded into contracts. And so you have to take a look at that. And then finally, there is tracking, reporting, and monitoring and tracking outcomes. Those are all things states are responsible for doing. And depending on the contract, those requirements may be more defined and aggressive than other contracts. So you have to be sure you understand and you are prepared with all of the tracking and reporting that's required to meet the federal requirements. Let's see. Yeah, this is a menu. Just, you all know this. These are things that could be embedded in contracts with shared service networks. You could do a variety of things. So I feel like you guys could add a lot to this one. I think about the provider recruitment and retention. I think this is an area where networks could do so much to help their lead agencies because all areas have special populations that need to be, they need assistance with. Families that need non-traditional hour care, families that are refugees, there's, infant and toddler care is often really hard. Family child care, we've all seen the decline that's happened with family child care. So these are things that states need assistance with, and these are ways that you can build your presentation, your proposal as to why you need to be a good partner with your state. Yes.
So I'm working right now with several states that are in the process of crafting contracts between the state of CCDF and a network of providers. So the contract is not with an individual provider, it's with a network hub. And so, for example, I'll make this up. I'm going to contract with this network hub for 100 slots for this period of time. The network hub will then make sure that those children are served among the providers in their network. Some of them are also thinking about, can I transfer eligibility determination for the subsidy to the network hub? So not to call out any names or anything, but I just want to get a sense from you about, are there things that you would encourage, discourage, caution us in terms of, because part of the issue that we're trying to struggle with is, as we craft these new strategies, must we follow exactly the same rules for the vouchers? Do we have more flexibility in, for example, the paperwork for eligibility so we can make it simpler? Do we have any flexibility around the eligibility guidelines for families? Can we make it similar in the context of the contract, through a contract, or do we have to follow what's in the CCDF rule for all vouchers?
I would say that's where you need to negotiate with the state. They do have to meet the eligibility requirements within the state. So there has to be, so it's very interesting when you look at states that have used contracts with providers, and they did studies, and then you can go and you can look at how implementation went. Eligibility is one of the areas where they all go, oh goodness, because they're responsible, the state's responsible for that error rate, right? And if they have providers, like one state, they contracted directly with the providers rather than through a network. And they were having providers do eligibility and enrollment. And it was a nightmare. Their error rate went way up for that group of providers. And so their guidance to other states was, do not ask providers to do eligibility and enrollment. But I think a network, you can set up particular ways that you're going to do that, that can assure the state that, you know, that you're going to take care of the eligibility.
At the end of the day, they're worried about their error rate.
Yeah.
So I want to go deeper, a little bit deeper in this, and let me just be provocative because I can
Yeah.
say things. So one of the problems with not giving eligibility to the hub is that it can often take months for a slot to get filled because the family can't work through the bureaucracy, the paperwork. So we really want the hubs to be able to do eligibility determination so they can fill those slots right away when a family calls. So how is it possible to make it simpler? If our hubs are using technology, can we basically right? Let's talk about how we can
Yeah.
make this easier because we want families to get into slots. And how much are states getting in the way by creating their own barriers?
Okay, I have two answers for you. One on the funding. The rules around those slots vary depending on which pot of funding the state is using to fund those slots.
Correct.
That is a big piece of that. The other one is if you build the eligibility requirements into your technology system, the system will do it for them. That's what we're doing in Nevada. Because we do want to look at having other entities, other community partners be able to have access to the system so that the family can have easier access, also to where the family can start their own eligibility, like going online, filling out their information. How do we simplify this? Build it into your system.
And then if you can assure the state that that system has covered all the bases so that they don't have to worry about their error rate going off the chart, then I think they would be all over it. So absolutely.
Yes.
And I can share a little bit of experience from California. So California has 69 R&R agencies. So they're the network for childcare providers. And then our 68 or 69 R&R agencies, they handle all that eligibility. So we have been working with 90% of these 69 agencies in the past 5 years. Some of the agencies are very innovative, implement technology. They actually handle the provider payment components as well. So some of the counties actually improved the provider payment turnaround time from 15 days to 2 days. Every week payments are going out. And then also, for example, in San Diego, folks are getting quite innovative. So they're embedding the employer-sponsored childcare together with eligibility. So now San Diego has a centralized eligibility list where if you're looking for childcare, so whether it's a Head Start, early Head Start, state-funded preschool, general childcare, or employer-sponsored childcare, you go to one single pipeline. And then that turnaround time is basically from application to eligibility to be on the wait list, it's 1 day.
Wow. Wow.
So to echo the idea that having that flexibility to have eligibility at a network level, it's extremely, can help the network to become very innovative.
And actually, to build on that, Tim, what I'm hearing is not only that flexibility, but automation that is designed to support that flexibility. That's two comments we've heard about.
Yes, absolutely.
Hi, I have programs. I'm a provider in Indiana and California. And I can already, and I've only been in California since Labor Day, but huge difference in CCDF and how fast we can get our children enrolled in our programs. One question I have is I've always wanted my programs to be able to be a CCDF agreement center. But when the grants come out, it's a 30-day window. It's pretty fast. Providers, if they're not on it, they're not on it. But because I've always felt like I'm almost an intake agent anyway, but with the work that we're doing in childcare deserts. I did ask my state, they're tying capacity building grants, we have capacity building grants going on, and then we're going to have these CCDF agreement centers or network hubs. And I asked, if you're expanding, you're already a provider, you're expanding another location, can you get one of these CCDF agreement slots? And I was, at least in this state, I was told no, that wasn't part of the plan. I wasn't sure, is that something written in the plan that you're not allowed to do that, or that's just the state would need to be a little more flexible?
Well, without looking at the plan, I wouldn't feel comfortable answering that question. My gut tells me it's a state decision,
Okay.
but I don't know that to be a fact. Or there may be a state law or something like that, procurement, whatever, but you can look in their plan and find out.
And I'd like to follow up on the data and the system conversation. We're seeing a little bit of a trend where states are moving toward integrated eligibility. So if you've not heard of that, that's where the CCDF lead agency and the TANF agency and the SNAP agency and the Medicaid agency, all those have partnered together, done some data analytics and realized, 98% of their families that are eligible for CCDF are already on another program in the state. So why not streamline that application process? I do know of examples where the states are moving toward integrated eligibility, where United Ways have access to determine eligibility. They're the R&R that determine eligibility in that integrated system. But I would caution you and probably just encourage you to build those relationships if you go down that road. It's really easy for the data folks in the state to say, per SNAP requirements, nobody that's not a state agency can be in this system. Well, yeah, no, it's been challenged and access has been opened up. Some states have more success with that than others. But that's about building that relationship, and that would allow the network hubs to be the eligibility unit to ease the burden on the eligibility workers from the other side. Oh, sorry, Lisa.
No, this is you finished. It's discussion.
When you said the state law comment too, or there's a law, there are many different interpretations of laws as well. So it's having those conversations. If you are looking at reference the law, like actually ask and go back. If you're being told, no, this is based on this, ask where that points to. Because if you can go back to that and say, and actually prove like this is not being interpreted correctly, or, I mean, there may be some room on those things too. So just a helpful hint.
For sure. Happened to me in Kentucky. The technology security guru for the state said, no way, your contractors are not getting into this eligibility system. I brought in the regional office from OCC, who brought in the SNAP regional office, and we got that line opened up. So the contractors were out. So don't let anybody tell you it's never been done, but I will say it's not the easiest thing to do, but it's doable.
All right, I think we've continued to have discussion, so we're going to move on. I think Mary Beth, you're up.
So what's in it for shared services network? But just by nodding of heads, can you all see that this is a bad thing for shared services networks to partner with the state? Anybody say figures as much? So I don't think I need to say a whole lot to it, but there's a lot of benefits for that partnership. One being the network hub has a dedicated funding for the client supply building and quality improvements. You also have the lead agency guidance and support. So just like we've talked about those quality dollars or all of these pandemic dollars, just like Nevada mentioned, that's an avenue to get those monies out the door when you have an existing relationship or contract with them. So that brings more money into your hubs when the state needs initiatives, being whether it be quality or even, outside of subsidy. Also participation in the state or territory strategic planning and implementation. Wow, the value. You all are working with these providers on the daily basis. You hear what the struggles providers are having. As a state partner, you can share those struggles with the state. The state welcomes that. They need to hear those things so they can push on their end from the regulatory or their leadership side. And again, access to new partnerships. If you've got a relationship with the state, a lot of times the state will say, we need you to get with our other contractor and figure this out. And it gives you partnership options. And then opportunities for expansion. I was in a session yesterday from Wisconsin. They just got 5 million from the state for their shared services. So once you get it started, the state sees, oh my gosh, this is an unmet need that we never realized. They're going to start pushing money when they have it your way to do additional things. And what's in it for the providers? So if you need to sell this to your providers, the grants and contracts option is dependable enrollment and funding. So, you know, a lot of providers, they can budget for that. It's a set amount. I was on a call with the state the other day that's doing grants and contracts through the Resource and Referral Agency. They're paying $22,000 a year for infants. So that is $22,000 to that provider for that slot for infants and toddlers. So that's not a normal conversation in the real subsidy world. You know, you have families leaving and you lose that money. Also the business practice supports that hubs naturally offer, access to quality improvement assistance, opportunities for expansion of providers. Even the same story I was telling you, I was on a phone call the other day. They started out with providers saying, we're going to pay for the hub, the R&R. So we're going to pay for 3 slots in your center. Well, there was a need and a demand, you know, word of mouth gets around. Families wanted that center. So the hub had the flexibility to add slots or giveth and taketh away. If you've got providers that aren't using those slots or they're not staying full, then the hub has the flexibility to do it with the state's encouragement and communication lines open saying, this center's, you know, the families are overwhelmingly wanting this particular center. So we'd like to move those contracted slots into this one. So those are opportunities for expansion at the provider level. Any questions, comments about that?
A little bit about gaps in service. So when you do a contract for a slot, you're buying a slot, you're not funding a child. And so there may be a certain amount of time when that slot is vacant because it took time to get the slot filled. So is there a federal rule around how long states could pay for vacant slots, or just help us understand what's allowed?
Again, they have to define it in their plan.
Yeah.
And they have to say, and so I've seen contracts where it's after 30 days, you know, a slot sits empty for 30 days, then the state is going to contact the family, give them, you know, 5 days or whatever. And then if that slot is not refilled with that provider, then they do a decrease in the funding. Another state, Marybeth heard about, it was 60 days. So again, that's a negotiated thing, but it can be a flexibility, but it's usually in their CCDF plan.
Sometimes it's driven by politics.
Sort of a follow up on that. How far in advance can like if a provider is looking to expand their facility to a new space or something, how far in advance can a contract for slots be awarded to that provider? Is there any rules around that?
States, I would think it's in the contract.
Yeah, it's usually the state's contracting process. So for example, I can think of one state that does contracts directly with providers. They release those once a year. So it's an annual process and they apply once a year, and that they've expanded. Now, if you are a contracted provider in this particular state I'm thinking about, for the next year, you automatically are the first one they come to with expansion dollars. So if you're a center and you've had a contract with them and you're in good standing and you're expanding, then you would get the first opportunity to just expand your current contract. So again, that is really dependent on the state and how they set up their contracting process.
Sort of related to that, wouldn't it be an encumbering issue? Like, let's say the state negotiated a contract, right, for slots, and they're saying, I'm going to buy 50 slots from you. They're probably encumbering the money for those 50 kids. At a certain point, do they have to, how long can they sit on money before the Fed say, hey, wait a minute, you didn't spend your money, we're going to take it back? Because a lot of this is a game, right? Trying to figure out where kids, until we have real-time supply and demand data, which I'm going to talk about later. It's a dance.
It is a dance.
It is a dance. And I think that, you know, the bottom, to me, the guiding principle here is to serve as many kids as you can. So obviously you don't want money sitting there with no child there. So I think it really, when you think about it that way, the state is going to be, they're going to be held accountable for how many children they serve for the money. So, you know, I hear your question. I can tell you in my state, it wouldn't have been much, just because they're like, we don't have enough money to serve the kids who are eligible. We can't afford slots to sit empty. So there's a responsibility within good practice of what this, you know, serving children and families is really all about. That and that goes back to those enrollment and those attendance policies. They have flexibility there. So they could say, we're going to allow for this many absences in a month, or we're going to, they can do all of that. But I think at the bottom line, that for me is putting on my state administrator hat, I'm going to be like, my auditor is going to be all over me if I haven't had a kid in as much as I can every slot. You know, and that's not realistic. I understand that. But to the extent that I can make sure that every dollar is going for a kid being served, then that should be my ultimate goal.
It should be all of our goals. If you look at the data, we only serve, the last report I saw, we only serve nationwide about 19% of the eligible families under the CCDF rules. So there are a lot of families out there that need the child care subsidy, a lot that do not get it. And so, and we talked about the wait list. Some states don't keep a wait list.
Correct.
You can be, just because a state says they don't have a wait list doesn't mean there aren't children wanting to get in those slots. That's important to know. Some state leaders don't want to keep a wait list because they don't want to know that.
Yeah, that's really important. Just because they say they don't have a wait list, that means they don't necessarily collect that information. So we're at our time.
Yes.
We have a slide in here around the relief funding, and I'm sorry we didn't have a chance to talk about it because there's still plenty of money out there. If you haven't gotten into the conversations, that I would encourage you to do that. There's the whole stabilization grants are for providers only. So that's money that's kind of dedicated, but there's a lot of flexibility over that money. And there's still a lot of money that has not been expended. Some to no fault of the state, I want to add. Some had to get budget authority, whatever. At the end of this presentation are a list of resources. So that will be, you know, that is in, all of these resources are either ours from our center or from the Office of Child Care. So there are some really good resources in there for particular things that you might be interested in. And with that, I'm just going to kind of end it because I want to be respectful. That's why we try to start on time so we can end on time. We are here afterwards. If you want to come up, I will send Louise those sites in the plan of where that's mentioned around shared services so that you can look up. You can go on your state's website. They are required by law to post their CCDF plan. Now they are in it. Some of them are in
Hidden.
have a few things to fix, but they're still on the website and you can go there and you can look at it. They're required to make it public. So, and each state, it's in a different place on their website, but if you put in CCDF state plan, I'm guessing that in your state, it will pop up. So I would encourage you to look at it and figure out ways that you can either increase your partnership or forge a new partnership. And thank you very much for being here. And we are delighted we could be here to share with you.
And our emails are on there, right?